how do we stay safe when masks are optional? And how do we keep our children safe when masks are optional?
Absolutely. Thank you so much again, Rajshri, and the entire team for having me here. It's truly my honor. And my God, I'm truly impressed with all this amazing work all you women are doing. Again, it's my first time and I'm just very touched, especially in the Women's Week. Having said that, yes, as you said, none of us were ready for this. Now, as we all know, we're stepping into the third year. We didn't know what was coming our way. It's an invisible enemy that we're fighting, and we have heard all these words. So the unknown still remains. The fear is getting better just because I can probably share some recent numbers with you. As of just this morning, as we know, more than 81.4% of US population has been vaccinated. So we have this, let's just say some kind of satisfaction that there is some kind of barrier against this invisible enemy. But taking away the masks, again, it was something to do more for the thought process of the community, as well as the battle that as physicians are still facing in healthcare. COVID is gone, but it's not completely gone. This variant, as we all know, is ever changing. Even though things have plateaued, we just don't know what tomorrow holds. So the uncertainty still stands. But I totally understand the burden and the decision making of removing masks, especially in children and across the communities, has been a big challenge for everyone. And this whole decision making is kind of following at this point to everyone, on individual school levels, the town levels, as focused groups to make this decision, what's right or wrong. So having said that, and coming back to your question, it's definitely, I would say, yes, we are at a more comfort zone now. Unfortunately, we can say that US still holds the top spot out of some numbers that we had seen. Out of 452 million people who were tested positive, unfortunately, 79 million of them are within the United States. The numbers are decreasing remarkably, but we still, I would say that we have to use precaution. Even though masks are being lifted, we have to use our own judgment at this time. We know more about how to treat the symptoms, but believe it or not, most of the COVID cases in the hospitals and nursing home settings are still being treated the same when we had initially started.
Is we haven't talked a lot about how those in nursing homes are being cared for. I mean, we've talked about the fact that many of us who have loved ones in nursing homes were limited, have had limited access, but how are patients, because I know that many of our listeners and watchers may have loved ones in nursing homes. How are they cared for? How are they staying safe?
Yes, it's a very good question, Rajshri, because just my recent work has allowed me to be part of the hospital systems, office, and nursing homes. And the biggest thing I tell everyone, the hardest thing is to see these loved ones suffer and even die alone during COVID. So even though the state has restricted and lifted a lot of barriers and visiting protocols, most of the patients who are coming to the nursing homes are still being put into the 7-day precautions. They are not able to go back to the main floors. And it's hard for the family, especially with coming from a high-risk areas, to be able to meet them, for the staff to care for them, or even us physicians, it's still the challenge that stood long time ago stands. And these are the patients who are coming out of a hospital setting and going into the nursing home, hoping to get that one-on-one interaction, more for psychological or even physical well-being, for that rehab. The barrier still stands today, but there is weekly meetings. The state has been actively involved to implement protocols. They're making visits, random nursing homes throughout the state to make sure, all the barriers and the protocols are visited. And it's a collaborative approach from the nursing homes, the families, as well as the patients, to understand that deep down it's the safety for everyone involved in the community.
One of the things that, as parents, biggest decision we had to make, I guess this week, for us and for other parents, it was before, was to mask or not to mask, because our school made it optional. How do you help? What advice do you give parents when they're making that decision and that consideration? And especially what about parents of children who are immunocompromised? What should they consider?
No, that's a very good question. This is a question I battled myself. I'm a mother of two, a high schooler and a middle schooler. So again, the first thing we can do is get them vaccinated. Of course, the risk is definitely there, much higher, I would say tenfold higher for an immunocompromised patient versus someone who's not immunocompromised. But the 3 doses of vaccine, as we know, 1-3-4 rule, first day, third week, and fourth week, or 1-4-4 rule for some of the mRNA vaccines is the first step that we can take. Other precautions we can take is, please note that some of the big conferences are still mandating a COVID negative test as well as use of masks, the big conferences. So even though some of the barriers are lifted, this, everyone in the community is still taking precautions, especially for these youth events, to make sure that's there. Even in those schools, the masks are lifted. It's actually not lifted, it's optional, at least in the North Villanova area. So parents are using those precautions for big gatherings, school events, sports. So I would say continue to do the same. If your child is sick, do the needful. Please make sure that you get them tested, give them Tylenol, Motrin, but be safe for your own kid, because that's the only way the message will get out there,
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.